Welcome to our channel. Today we're diving into the ASPEN study, comparing two BTK inhibitors, Zanubrutinib and Ibrutinib, for treating Waldenström Macroglobulinemia, or WM. Whether you're a healthcare professional or a patient, stay tuned to learn about the latest insights in WM treatment. Waldenström Macroglobulinemia is a rare type of lymphoma characterized by an overproduction of IgM antibodies. A key factor in WM is the MID88L265P mutation, found in over 90% of cases. This mutation activates the B-cell receptor pathway, promoting cell survival. BTK inhibitors like Ibrutinib have been effective in blocking this pathway, but can newer drugs like Zanubrutinib offer similar benefits with fewer side effects? That's exactly what the ASPEN study set out to explore. This trial involved approximately 200 patients with WM, either previously treated or untreated but ineligible for chemoimmunotherapy. Patients were randomly assigned to receive either Zanubrutinib or Ibrutinib until disease progression or unacceptable toxicity. Patients were given Zanubrutinib at 160 mg twice daily or Ibrutinib at 420 mg once daily. The main goal was to compare the rates of very good partial response, or VGPR, or complete response, or CR, between the two drugs. After a median follow-up of 19.4 months, neither group achieved a complete response, but VGPR rates were higher in the Zanubrutinib group at 28% compared to 19% for Ibrutinib, although this difference wasn't statistically significant. This suggests that Zanubrutinib may offer a slight edge in efficacy, but more research is needed to confirm these findings. Progression-free survival, or PFS, was also promising for both drugs, with median PFS not reached in either group. The estimated 18-month overall survival rates were 97% for Zanubrutinib and 93% for Ibrutinib. These results indicate that both drugs are effective in managing WM over an extended period, providing hope for long-term disease control. When it came to safety, Zanubrutinib showed a more favorable profile. Although it was associated with higher rates of neutropenia, it led to significantly less atrial fibrillation and bleeding compared to Ibrutinib. Specifically, the rates of atrial fibrillation were just 2% with Zanubrutinib versus 15% with Ibrutinib. Bleeding events were also lower with Zanubrutinib, making it a safer option for many patients. These findings have impacted treatment guidelines. According to the National Comprehensive Cancer Network, or NCCN, Zanubrutinib is now a preferred option for both newly diagnosed and previously treated WM patients. This shift highlights the importance of considering both efficacy and safety in treatment decisions. In summary, the ASPEN study shows that Zanubrutinib and Ibrutinib offer similar efficacy in treating WM, but Zanubrutinib might be better tolerated, especially regarding heart-related side effects. This makes it a compelling choice for many patients. As always, treatment decisions should be made in consultation with healthcare providers, considering individual patient needs and circumstances. If you found this video helpful, please give it a thumbs up and subscribe for more updates on hematological disorders and treatments. Have questions or topics you want us to cover? Drop them in the comments below. Thanks for watching. Stay informed and stay healthy.